Good day, everyone. I am Karina P. Cope, a nursing student from Visayas State University. Right now, I am going to discuss about rabies. What is rabies? It is a viral illness spread via the saliva of an infected animal by the rabies virus. Rabies exposure occurs usually through biting a human or another infected animal. Transmission can also occur through saliva touching an open wound or touching mucous membranes. It is caused by a virus that affects the central nervous system, particularly causing inflammation in the brain. Domestic dogs, cats, and rabbits, and wild animals such as raccoons, skunks, and bats are able to transfer the virus to the humans via bites and scratches. Early signs and symptoms of rabies mimic those of a viral flu-like infection, and according to the World Health Organization, up to 59% people worldwide die from rabies every year, and 99% of them have been bitten by a rabid dog. Risk factors includes any activities that bring someone in contact with possible rabid animals. Activities like traveling in areas where rabies is more common, like places of Africa and Southeast Asia, as well as outdoor activities near bats and other possible rabid animals. Now let's move on to the pathophysiology of rabies. Rabies virus in saliva, also found in tissues of an infected mammal, enters the host through bite and is deposited into the muscle and subcutaneous tissue. Other mode of transmission includes contamination of mucous membranes, aerosol transmission, and corneal and organ transplantation, but these cases are rare. And then, virus remains at or near the site of introduction for most of incubation period. The usual incubation period of rabies is 2 to 8 weeks. However, it can also belong to for a year. It depends on the severity of the wound and resistance of the host. And after the incubation period, the virus travel into the peripheral nervous system or PNS through nerves or neuromuscular junction. And it moves rapidly centripetally to the central nervous system for replication, which causes inflammation of brain and spinal cord. Virus continues to attack the central nervous system and travels outward to many locations of the body, including the salivary glands and corneal epithelial cells. There are two types of signs and symptoms of rabies. Furious rabies includes insomnia, anxiety, confusion, agitation, hallucination, excessive salivation, problems of swallowing, and fear of water. While paralytic rabies causes the infected paralyzation, which eventually lead to coma and death. There is no test to detect the early stages of rabies infection, but after the onset of the symptoms, a blood, tissue, or saliva test will help a doctor determine whether you have the disease. And then once symptoms for rabies appear, there is no treatment. However, a vaccine can be administered after an exposure. The indication of vaccination depends on type of contact with the rabid animals. If you have exposure, a series of injections of rabies immunoglobulin and immediate rabies vaccination are needed. If you have single or multiple transdermal bites or scratches, leaks on broken skin, contamination of mucous membrane with saliva from licks, or exposures to bats. Immediate vaccination and administration of rabies immunoglobulin and local treatment of wound are needed. Let's move on to the nursing diagnosis for rabies. It includes imbalanced nutrition, less than body requirements related to decreased swallowing reflexes, hyperthermia related to viremia, anxiety related, including the family, related to exposure to information, risk for injury related to seizures and weakness, risk for infection associated with open wounds, and ineffective breathing pattern related to asphyxia. The nursing management for rabies includes to provide patient isolation, washing hands before and after patient contact to prevent self-contamination and spread of disease, and then give emotional and spiritual support to the family by helping them cope with the patient's symptoms and probable death. Also to darken the room to provide a quiet environment. The patient should not be bathed and must not have any running water in the room, and, and should continuously monitor cardiac and respiratory function. The recommended post-exposure prophylaxis administration. Remember too that a patient who is exposed and has never been vaccinated against rabies should give intramuscular of rabies immune globulin on day 0, give 1 ml of rabies vaccine on days 0, 3, 7, 14, and 28. If the patient has previously vaccinated with the cell culture vaccine and previously demonstrated rabies antibody, he or she should receive 2 intramuscular doses of 1 ml each, one immediately and one 3 days later. Rabies immunoglobulin should not be given. And take note that administering IM in the deltoid area in other children, adults, and in the mid-lateral aspect of the thigh in young children. Also, never administer rabies vaccine in the gluteal area. This may result in an inadequate immune response. Post-exposure prophylaxis dose must be given as soon as possible. If you ever got bitten by a dog suspected of rabies, immediately do the following. Thoroughly wash the injured area as soon as possible after contact with the suspect infected dog. Wash it and soap or detergent with soap or detergent under running water for 10 to 15 minutes. Disinfect the wound by applying a simple amount of an antiseptic such as povidone ion or 70% alcohol in the wound area. And then find a doctor and seek medical help immediately for further rabies treatment after dog bite. These steps may help prevent the disease from becoming fatal. Other simple measures you can take to help keep you from catching rabies includes get a rabies vaccination before traveling to developing countries, working closely with animals or working in a lab handling the rabies virus, vaccinating your pets, keep your pets from roaming outside, report stray animals to animal control, avoid contact with wild animals, prevent bats from entering living spaces or other structure near your home, and you should report any signs of an infected animal to your local animal control or health departments. That's all for today. Thank you for listening. I hope you learned a lot. Thank you.